A great pleasure to take part in this debate today. As important as it is, we should not have to have the same conversation over and over again, while on the surface, this debate is about importance of meaningful and transparent data. We cannot forget that each of these so-called data points are people. People with hopes and dreams, worries and fears, just like each of us here in this chamber. We are not talking about the abstracts here, not discussing statistical curves. We are talking about the human beings who just want to lead healthy and fulfilled lives. The World Health Organization defines health as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. Their constitution states that informed opinion and active cooperation on the part of the public are of the utmost importance. In the improvement of the health of the people, government have a responsibility for the health of their peoples, who can be fulfilled only by the provision of adequate health and social measures. By this definition, by any rational definition, we are failing. Our care pathways are broken. Bottlenecks exist throughout the system, which get worse every time there's a bad flu season. Now, with the added complication of the COVID in the mix, it is little wonder that we have over 27,000 people waiting for more than 2 years for treatment. Compare that to the English NHS, who only have 300 people awaiting treatment. It is incredible. Almost 1% of the Welsh population waiting for years in pain and discomfort, compared to 0.001% of the English population. We spend more per head on health, so where are we going wrong? Why did we have 16 ambulances going up outside a major hospital in my region? Why was one of those ambulances waiting outside the A&E department for 28 hours? The answer is as simple as it is complex. At its root is a bad planning and mismanagement. The complexity comes from looking at who is making the bad decisions. Sadly, it is at every time, from the top to the bottom, from Welsh governments to local governments, officials. The First Minister told us yesterday that there had been plenty of ambulances on the roads at the weekend, but the problem with the Morriston lay with the flow into the hospital. He is right, of course, but he can't shirk responsibility. It was his government that failed to plan for adequate social provision. It is his political dogma that is leading to the closure of private care providers. Hollins Care Centre in Camilla is being forced to close, despite a good inspection report just weeks ago, without any coherent reasoning from the council, and to the dismay of the residents and staff. I was deeply shocked to see the reports of long-term residents in tears as they were loaded onto ambulances. We don't have enough care provision, and yet councils across the nation are waging war on private providers, driven by a little more than political hatred of the private sector in care. We saw the scenes when RCT decided to outsource long-term care provision. The unions were up in arms, but in the real world, there's no public sector care provision. And as a result, the scenes at Morriston and E are, according to the First Minister, more likely to occur. It is time the Welsh Government stops doctoring the figures, admit their failings, and get on with fixing our NHS. Diolch yn fawr.